Hi, my name is Patricia King, and I'm here today to talk to you about a technology investment proposal for Sunshine Hospital. Before we get started, our agenda will include an overview of Sunshine Hospital, technology investment proposal recommendation, public policy analysis and proposal justification of the recommendation, the projected outcomes and cost savings, as well as an economic incentive and opportunity analysis. Located in Fallbrook, California, the mission of Sunshine Hospital is to restore comfort and promote quality health within the community. This rural community has a population of 31,701 residents. The average median age is 37.6 years old. And the current operating budget right now, expense, is $2.25 billion. Unfortunately, over the last several years, we've had complaints and issues brought to our attention by patients throughout the community. 12 of our top complaints include that patients are frustrated having to bring paper records to the hospital, that the hospital often runs duplicate tests because records aren't available, physicians and nurses are in a hurry and don't effectively follow up or communicate with patients, departments don't effectively communicate within the hospital amongst one another and with patients. Supply issues have caused a problem in timing of care. The patients are seeking real-time updates, but doctors, nurses, and staff aren't available all of the time to provide this information. Facilities are old, uncomfortable, outdated, and obsolete. Readmissions keep occurring because follow-up with patients after care can sometimes be forgotten or overlooked. The ratio of physicians and nurses in this rural area is extremely low. Rooms are cramped, uncomfortable, as well as parking facilities. With the data comprised from our patients, we have identified 3 potential investment opportunities that include the possibility of a facility renovation, a facility expansion, or clinical integration of electronic health records. We believe that these 3 different things can improve the complaints that our patients have shared with us. However, with limited funding and budget capacity, we are only able to pick one of these options. The selected proposal idea is clinical integration of electronic healthcare records, otherwise known as EHRs, and the identified software is Epic EHR software. Costs can be reduced by improving efficiency. These EHRs are more than a patient's medical history, diagnosis, medication, treatment plan, immunization, allergy listing, radiology image, and laboratory and test result. They allow evidence-based tools that providers can use to make decisions about patients' care. They automate and streamline provider workflow, increasing efficiency, communication, and patient engagement. Utilizing the concept of normative economics, we utilize the values from our patients to identify these best options. In alignment, it's important that public policy analysis and this proposal are justified. This electronic healthcare system is also HIPAA compliant. It aligns with ACA mandates to improve the quality use of technology, improves health outcomes. Data collection analysis can be done to assess global, current, local, and community trends around disease burden, targeting and implementing and monitoring different conditions. Government cost savings can also be done. There are alerts in these records that can prompt providers to obtain advanced beneficiary notice, minimizing claim denials and lost charges related to Medicare procedures performed without advanced beneficiary notice. This results in a cost savings not only at the government level, but also with patients and with providers. Projected outcomes and cost savings continue to flourish with this investment and proposal. Reduction of the unit of cost of care of delivery will occur, the reduction of transcription costs, improved documentation and automated coding capabilities, the reduction of medical errors, improved patient health quality care through disease management and patient education, an increase in patient volume by attending appointments due to alerts, reminders, and telehealth capabilities, improved medical practice management through the integrated scheduling systems, time saving with easier centralized chart management, and reduced admissions. The economic incentives far outweigh the opportunities in this proposal. Different incentives include telehealth, mobile health, safeguarding of information, improved communication, patient engagement, efficiency and cost savings, improved risk management, and increased patient satisfaction. Thank you so much for your time today. Without reservation, I highly recommend the implementation of an EHR at Sunshine Hospital in Fallbrook, California. Have a great day.